Hey everybody, this is Chris. And Al, what time is it?
Hey, I think it's time for another podcast, Chris.
That's right, another episode of Readiness Rewired, a healthcare preparedness podcast. I'm Chris.
I'm Al.
And I'm Mike.
And I think for this podcast, Al's serving up the topic.
Thanks, Chris. Well, I know a lot of people in the emergency preparedness roles within their facilities are asking the question and are kicking around, how do we best do an active shooter exercise within our facility? How do we train our staff? And there's a lot of different things we could do. So I thought this podcast, it would be interesting for us to share what we've done previously in our facilities to address, an active shooter event that comes within our healthcare facilities, in the hospitals, in the clinics, and even in the nursing homes. So there's where we want to go. I've talked about, I've heard people in the past put an exercise on where they've announced overhead, we're going to have an active shooter exercise, be aware. They've had the guy come in with the ski mask and the squirt gun. And I'm not a big fan of that in a real environment where we have patients and visitors. One thing I always remind people about is, we have the signs on the doors in the hospitals that says no guns allowed. Well, no guns allowed for the people who want to listen to it. And even those good citizens who have a carry permit might be carrying a gun. In larger hospitals, I got to guess they've got the carry permit and they just ignore it because they've got permission to carry. So we put on an exercise, and I've heard of this. We put on an exercise and we announce it and somebody doesn't hear it. And here comes a guy down the hallway with a ski mask on and a squirt gun. And the good abiding citizen who's got the carry permit pulls his gun out, shoots, and kills the victim in the exercise. And now you've created a bad situation. You've also created a situation where I've said to my executive team, I'm the one getting fired because I put on a bad exercise. I think there are ways to do it, and that's why I'd like to hear from you guys as well. But I want to be careful that we think through the processes before we do. Mike, Chris?
Well, no, but even before the exercise, I'd say probably one of the biggest obstacles is getting your homework done. I think you need to have conversations with local law enforcement, public safety, and your own administration about what are in their minds are the plans in approaching and managing such an incident so that you can build around it and have your policies and procedures align with that. Because really the exercise, unless you're doing an exercise to establish the need to have those, and I think that's almost a foregone conclusion for most of us that, yeah, we definitely want to know and have a plan in mind. So I know in my past, there were some real surprises about how law enforcement felt they were going to approach, make entrance, and move through our facility, and even concepts like incident command during and after such an incident. That I was glad that we were able to have those conversations. And then the one other one, Mike, I throw in there is really having a good idea about cover and concealment for those that are thinking run, hide, and fight. What are best or better hiding places if that's one of their considerations throughout their facility? So, I mean, there's just, what's bulletproof versus bullet resistant versus simply, a hiding place that you're out of sight but not necessarily well protected. There's just a lot of homework that really needs to be done and understood. They talk about barricading doors, but if your doors swing, out, that doesn't really work very well to try to barricade a door from the inside. So lots of homework. Mike?
I agree. Lots of homework. And I think, let's face it, in exercise, you're supposed to be testing the plans that you have already made and have down on paper and have hopefully trained your staff about, right? So the exercise then comes in as that stage of you're going to see where all your gaps and holes are. There can be a lot of them. Chris is right. And I think the interaction with your community response partners is critical, not only in the planning process, but obviously when you're going to start to develop the exercise, just how involved do they want to be? Sometimes it's been my experience that sometimes the community response partners just may not feel that's a timely exercise to have. Okay. I've run into that before. Yeah, we really need to do that, but we have some other things we need to address right now. We're just not ready to do one. Where maybe your leadership is saying, yeah, we want to get this on the books. We want to get this started. So then you have to come up and have a creative sort of sit down and say, can we do this without active, full-scale participation of our community response partners? My answer is yes, you can do it. Now, nobody likes to silo, right? But sometimes you have to, because timing may not be right. Our EMA friends, emergency management folks at the county level, they have a cycle that they follow. Some of them are pretty strict on the exercise cycles that they follow. And maybe your idea to do an internal in the hospital, armed intruder, active threat kind of thing isn't on their list right now. So then you got to readjust and say, okay, how can we do it internally with the resources we have here? And could we at least get, some law enforcement participation? And what I've done in the past is I've had them come in to the command center during the exercise, and we know that's not realistic right off the bat. Hopefully, if you're doing a sort of community response kind of thing, that you'd have shared incident command, that sort of thing. But, having them come in and actually be in the command center, hospital command center, when you do the exercise to provide law enforcement input can be at least that useful part, right? Boy, and then getting into how you're going to do something internally is going to be really interesting. The one thing I will tell you is I've done it a number of different ways. One way is pick the Saturday. Don't want to have an exercise if it's full scale where you're actually going to have somebody providing the threat, and it's a true threat. You don't want to, my opinion is what Al's saying. I don't want to mix people with that, right? Yep. So what we did was we took a Saturday where we have a building that's right on our campus, linked to the main complex, and there's really nobody in that building on a Saturday because there's mostly clinics, lots of clinics. And so you take a building that's essentially empty, still part of your complex, and conduct the actual full-scale exercise in there with staff who are normally staffing that particular area, and then have the threat come in. And so everybody knows it's going to happen, right? But you orchestrate it in such a way where you can isolate it. Because let's face it, and this is true if you look at the literature, the vast majority of in-hospital active shooter threats are focused, right? It's not a random, like somebody walking into a movie theater and just randomly going through. It's targeted. Yep. It's a targeted threat. So that's really the majority of the ones we've done, and then tried to keep it contained. But everybody knew that, and so what we did was we actually videotaped everything of that shooter. Had overhead security camera footage, filmed it all on a Saturday, had the law enforcement tactical team come in and do the whole 9 yards. We got video tape from their vest cams, put it all together, right? Had a threat guy, the perpetrator, actually using a blank provided by law enforcement. And then we had victims that were brought down and, had to deal with that. So we did the whole full scale sort of event, but then we actually did the exercise on the following Tuesday, where we involved incident command, leadership, and doing an alert of the facility. Okay. But everybody knew there was going to be an exercise that day, but the actual real full scale piece was filmed and done on a Saturday when portion of the complex was empty. And that all worked out because then everybody in the command center got to see something like this and how it would evolve and transpire. And by bringing your command staff into the scene and actually having them see it, I found that the discussions were quite quite useful, and a lot of things came out of their minds that they never really even thought of. And then having your law enforcement people in the command center when this was all going down, you give them the opportunity to make guidance and say, hey, well, if this happened today, right now, here's how many officers I could have here. Here's who I'm calling for help. Here are the other agencies that are going to come in. And here's probably what you're going to see is this ring around your facility that nobody can get in or out. And so a lot of good stuff comes out of it that way. So it's a lot of work. It's a lot of people involved, but sometimes you can get it done and lessen and reduce the chances of it actually triggering something bad like you described. Yeah, we
Right.
want to
And
avoid that. Worst case
and I
scenario.
like your yeah, and I like your statement about you're also testing policies, because there are policies that need to be tested and finding improvements that need to be done, and that the description that you just did was a great way to do that. And then bringing your incident command team together and doing that incident command training or education so they can have that conversation is great. You mentioned facility alert testing. We don't, yeah, we tend to not do that as much as maybe we should, because we don't want to interrupt everybody's day or night or whatever the case may be. But that facility alert testing and having everybody kind of feel what's going on, I think is great. The thing that I like to also promote in this is, because in a facility of X size, and I don't care if it's a small or large, when you do this actual drill, you shut down an area and you bring some staff in and you do the things. It's still intense, but I also want to get out to the rest of the staff that awareness training, and that's the thing I like to include with things like active shooter. Very similar to what we do with our fire drill training. We'll go up to areas and say, hey, this alarm just pulled, what would you do? And walk the staff through some questions. Then we will pull some fire alarms from here to there and see what's going on in the facility, in the building, in the area. But I'm very cautious when we talk about actual activity in a live area, patients, visitors. And that's the conversation I really wanted to have, because it's an interesting one that a lot of emergency preparedness people struggle with, is how do I put on a really good exercise, or how do I train staff? And, great examples, Mike. Thanks.
Yeah, I want to throw a couple of points out there. One is just for clarification for people that maybe don't participate in drills and exercises, that exercises are the more comprehensive testing of response plans, whereas drills are more focused. They're either focused by department or by function. So Al mentioned like the overhead paging or the mass messaging testing part, or the locking down of a facility. Those would be examples of where you're focusing on maybe a drill. And I think safety is another concern when you do an exercise. It's a concern when you have a drill, but when you have a lot of moving parts in an exercise, both of you are talking about scenarios that are fairly realistic, that have sounds that can trigger PTSD or pretty profound emotional responses for people that didn't think they were going to have them. So active shooter in particular, active shooter responses are exercises that have to be very well planned and staffed and have contingencies for people. I know some facilities that let people know the window of time for the exercise, and then identified those that had real concerns about participating. They may have a history of PTSD, or veterans that have had some really challenging experiences in the past that didn't want to. And then safety also includes the public when they come in, because you're going to have people with earbuds or headphones on and not hear overhead paging that are saying it's just a drill, that may see somebody scurrying around with a gun that's actually not an active shooter. I know there's at least one VA hospital where that happened in the ER, and the person that was role playing the shooter was got into a fight with somebody that had earbuds and that didn't know it was an exercise. So, it's got a lot of moving parts. And I would say that it's of all the exercises we do, it's got to be one that really because of those, those unintended consequences. It's got to be really thoughtfully done. It can't be done cavalierly. And sometimes it can be done so cautiously it doesn't meet any of the objectives either. So it's figuring out what exactly your objectives are going to be that you're trying to accomplish, and maybe doing it in stages. So I doubt, Mike, that the exercise you were talking about was thought of one week and conducted the next. There's probably a lot of planning, a lot of considerations for keeping people clear of the area where you're doing the mock, the firing of the blanks and stuff like that. Yeah, you let law enforcement know that you're having an exercise. So if somebody doesn't know what's going on and calls it in, you don't get an actual response. Those sorts of things, right?
Ton of planning. And let's talk about the big elephant in the room, and that's the appetite of your senior administration for one of these kind of events. Sometimes you run into senior administration that might be way cautious, like you mentioned, and say, "Oh no, man, I don't want to do that," or that's too much of a risk, or I don't want the wrong idea coming out about something like this and whatnot. So support of senior leadership in your facility is absolutely essential, right? And you guys know as well as I do that we listen to our colleagues around the region here and whatnot, and that senior administration support for your efforts in emergency management to start with can vary pretty greatly. You can have some that were intensely involved and they're 100% behind it and whatever. And then you've got senior leadership in some facilities that it's difficult to get them to show up and actually participate in these exercises. So that's one of the great and unfortunate variables that we in this industry, I don't care how big or how small your facility is, how much industry or how much leadership support do you actually get for your efforts? And then you throw something like this in there and holy cow, like you say, there's a lot of things that can go wrong if this thing isn't planned well. And if they're not on board with every little thing that you're doing, that could be tough. I was personally lucky because in our community, we've had active shooter events that have occurred in our community, close on our campus. And so
that's not
bottom
luck,
line
Mike.
is
That's not luck. That's not luck that you
luck.
had them, but you had the benefit of them. If there was a benefit, right?
The point being is that it's not the attitude of it can't happen here.
Right.
Wasn't going to be a barrier to what we tried to get done, right? So getting senior leadership buy-in. The other fortunate thing that I really had was I'm a direct report to the C-suite. So my position in emergency management, I reported directly to the COO of the hospital. So I had the ear of senior leadership and said, hey, here's the idea we want to do, blah, 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 blah. So I could get immediate response and immediate feedback. And since he or she is my immediate supervisor and takes on overseeing the emergency management program, the likelihood of getting buy-in from somebody like that is better, right? And then we use the CEO as the primary incident commander when our incident command structure is stood up. And so that's very unusual in some places, or it used to be. I remember when I took my incident command training at one of the forts here in the region, they were saying, oh, you never want to have that. Don't have them as your incident commander. And I'm like, our facility and our area feels differently about it. Because if they're that intimately involved in your emergency management program, you go to them with something like this, that you want to do an active shooter, full scale in the facility, you got a little better chance of getting them approving it and actually being involved in the planning.
Yeah, and I like your thoughts of that administrative and executive involvement and approval, because I think so many people go off and do it in their silo. And that's a dangerous way to do it.
Especially one of these.
You're especially
right.
one of these.
Especially this one.
Yeah, yeah. And yet I don't want people to forget that, a great exercise, we learned some things, we did some things. Remember about the rest of the employees and how you're going to get that education and awareness out to them more than thinking that you've checked the box, you've done a drill, you've met your CMS requirement or whatever the case may be. Because it's a lot more than that for us who really care about emergency preparedness. Is it getting a benefit out of the exercise and then sharing that? Because I remind people, if you do an exercise on days.
Sorry, Al. That's the acronym jar. What was CMS? What does that
Oh,
mean?
thank you. Center for Medicare and Medicaid Services. Thank you, Chris. And yeah, so and that's our accrediting body for Medicare and Medicaid that the hospitals and others get paid for their services. So thank you for that. But taking a look at that and just not checking that box, but making sure you remember all those other employees that are on second shift, third shift, weekend shift. Now you can't do necessarily exercises on all of those all the time. If you've got a staff of 1,000 or 5,000 or 15,000, you got to say, okay, we did this exercise to check our policies, to bring our incident command team together, to get some learning and education. Now what for the rest of the staff? And it's great to do some online training, but I like to also do, a little more awareness training with them to make sure, because in one of the slides I have for some of the training, I talk to people and say, the body can't go where the mind has not been. So if you think about it first, and if you have thought about it and brought it up and talked about it and everything, now you're a little more prepared. It's still going to be horrendous if it ever, knock on wood, happens. But it's better than never having addressed it before for all the staff that haven't. Oh, I don't want to think about that. Yes, I want you to think about that, because if you think about it, then if you're in an incident, your body's going to be ready to react a little bit quicker.
Yep, well stated. Hey, I want to circle back to the homework ahead of time on something like this too, and just something we learned is we routinely call incidents like this where we're going to secure all of our exits internally and to our building to try to slow movement as a lockdown. And it was reaching out to our law enforcement partners. They clarified with us that it's lockdown if the threat is inside, which is the case when we're talking about these active shooter experiences. But the term is really shelter in place if the threat is outside. Even though you're doing the same actions, you may be locking all your exterior doors, perhaps internal doors, interior doors as well. So, it's kind of getting on the same page in terms of terminology. It's also getting an understanding of, the size of your building or your complex, Mike, right? Multiple buildings, and how long an incident, we call it an event. Most events are actually scheduled. So again, in disaster management language, it's an active shooter incident. It's, how long can you realistically expect to be hiding or have run and left your location before you come back? And so, beyond the simple actions of, bang, bang, shots are fired, what are you going to do? It's what are you going to do for how long? And then how do you come back to that? As far as some areas, you're going to have the immediate need is going to be it's crime scene. And really, there's not going to be a lot of activity or altered activity is going to have to occur around it. And so there's the consequence management phase. So you have kind of the preparation ahead of time, and you try to do the prevention piece, which is through workplace violence programs and threat assessment teams that we hopefully reduce our interior threat of an employee or somebody going rogue on us. So we have some prevention work. Then we have the awareness of, we're going to do the drills and we're going to do our further restricting access drills, whether the active shooter's in the community and we have to lock our doors for that reason, or it's a lockdown because we have them inside. So you have that component, the overhead language. Are we going to use the words active shooter or shooter, active threat in plain language, or are we going to use coded language, kind of go through that piece? And then, again, what are the best places to hide if hiding is your best choice? as you go about your duties during the day in your facilities? And then do we do it all? Do we all run, hide, and fight if shots are fired in the emergency department and you're in a complex or a huge building, and most of the time, in fact, I'm not sure I can recall any active shooter incidents in a hospital. If they're targeted shootings, they're going in with a particular, threat that they're perceived threat that they're responding to, meaning the shooter. Does everybody have to respond? There's just lots of questions to go through, and either be aware of and not have answers, but say you're working on it, or try to have tentative answers and make sure they align with your community partners or with industry standards. So, like I said, there's some pre-work. Your policies and procedures may only address the first part, the run, hide, fight, or whatever acronym you choose to use, and not deal with consequence management. But I know working with our law enforcement, we understood that incident command was going to be the back trunk of a vehicle until the place was secured. And again, on a complex, it's going to take longer to secure perhaps multiple buildings. We also learned that IEDs, improvised explosive devices, are frequently also involved with active shooters. So the idea of running and hiding, you had to have some sense of your awareness and of where you're going, and that you're not triggering those sorts of things. And then, something we really struggle with is if people leave, how do we account for them when immediately after the event we're trying to figure out where people are at, and how do you kind of repatriate them in terms of when they can come back, who do they contact, and all of that. And I think there's these little pieces that a one-page active shooter policy doesn't really address, that you need to think about, and then say, hey, in this exercise we're going to focus on our incident command awareness, or we're going to focus on our lockdown and you finding the best place to hide, or we're going to test our overhead paging, and if we're going to do an all clear after active shooter, can you hear it in the place that you hide? Because a lot of them are these closets or parts of the building that may not have access to that. So how do we make you aware that an event's over? And then, of course, again, how do you activate the resources to help deal with the casualties and the mental sides of things? So I know we have community resources, regional resources through CISA, the cybersecurity and infrastructure folks that are under DHS, which is Department of Homeland Security. I want to avoid the acronym jar if I can.
I was going to ring that jar if you didn't do that, Chris.
I knew you were going to do that.
Yeah.
But there's some excellent stuff out there. Again, Asper Tracy, the federal program. I can't recall what all those initials now stand for since they changed it, but it's the federal level preparedness, has some excellent resources on it too. So lots of stuff to look at. And then peers, right? That's what we're doing right now. We're talking about, and we have over the years said, hey, I've tried this. Hey, I heard about this. You start to put all those things together into this big Mod Podge that's your exercise.
Well, and the thing I like about the conversation is I've had the conversations and thinking, I've got my mind set on a particular way, and when I share with others, they go, "Oh, Al, but did you think about this?" "Oh, gosh, I really didn't." And I have actually changed my mind on some direction over the course of time. Believe it or not, gentlemen, believe it or not. But I got Mike. I got a question for you, because you would probably know. Is Chris part Italian? Because for those of our listeners who are not watching us but just listening, Chris talks a lot with his hands, and then he's banging on his desk a lot. And so if the people are wondering what's that pounding coming, that's just Chris getting excited, and Mike and I love him. So you can just tell when Chris gets really enthusiastic about something, because his hands start going and he starts banging on the desk a little bit, and we all get it. But you brought up I want to circle back around, because you brought up a great thing that people have asked about too, and that is, and you mentioned it, about, what happens in the fleeing part, the run, hide, fight, the running. I've heard some people say, well, where do you have a gathering space? And I shake my head and I shudder a little bit and say, look, time out. In my opinion, this is not a fire where you set up a gathering space for everybody to go out and make sure you get accounted for. This is a whole different scenario where please don't gather any place, because that's just ducks in a pond for somebody to, do some other bad things with. Get out as best you can. And if we don't know where you are, we'll figure it out later. And for those who are working in the hospital setting, the nurses and doctors and other people, they'll come back to their departments. I'm not worried about that. And if a few of them don't, I understand that as well. So, that gathering spot thing that some people have a concept about and always ask about. I was in a meeting at the EMA with the county people and some other community members, and they started talking about a gathering space. Which one did I do? EMA. Emergency Management Association. Yeah, our county watchdogs for emergency things. But I was in that meeting and they started talking about gathering space. And I went, oh, please. And there were some police there, and they backed me up and said, yeah, it's not really a gathering space type thing when in this particular tragic incident happens. You get out, you fend for yourself, and if we need to know an accounting of everybody in the building, we'll figure it out later, because we really don't need to know for the most part. That's my thoughts.
There's so much to talk about when you get into one of these things, right?
Yeah.
A couple things off the top of my head that were really good things that came out of our several, we've done a number of these things. One is, when you have a facility that's large, it's a huge challenge putting on an exercise like this. And realistically, you think about, all right, if most in-hospital shootings are targeted, they're coming after somebody, a nurse, a surgeon, a doctor. We've had some euthanized situations occur in the country too, where somebody comes in, they have a loved one that isn't doing well, didn't do well, was treated, and they decided to go in and euthanize them and then take their anger out on perhaps, the staff that they were being taken care of. I remember I contacted one of my colleagues out at Hopkins, Howie, and been there for 20 years after they had an internal one at a very large academic medical center. Sat down and listened and talked to him for probably about an hour and a half to 2 hours, just learning some things. How do you respond? How do you do better? What did you do different? There's a number of things, especially if you're dealing with a larger facility. For example, the police are going to ring your facility. They're going to put a tight ring around that place, because you're going to get every law enforcement officer and their brother coming in. And if you got staff wanting to leave or coming back on duty or trying to come on duty, and then if it's off hours and you have leadership or incident management staff that want to come in and do that, guess what? It's going to be tough for them to get through that police barricade or blockade around your facility. And that goes for patients too. That goes for ambulances trying to get into your emergency department. So you have to have plans for all of that thing. But one of the things people really need to consider is, when an incident like this happens, you ought to think about having an off-site or maybe 2 off-site potential command posts where your leadership can gather and manage the incident if they are not exactly on the facility's property when it occurs. So that's number one. We actually developed 2 off-site potential command posts where staff could gather, who would be leading sort of the incident if it was not safe or they could not get access back into the facility. Ever since COVID, it seems like everybody takes their name badges home, right? Used to be they never did. They just drop them in the drawer and leave. Well, now with COVID, after happening, we're controlling access into the facility more than we ever have before, and people are bringing their IDs home. And so that's good. That actually can maybe help get them back through into the facility after something like this. Another thing is doors. Are your doors named, or are they numbered in any way? If you've got a number of doors, that becomes a real problem, because the officers coming in to try to help you need to know where to come in. And
not all of them know your facility. Right.
No,
right.
Most of them don't. And so, I wanted to number or letter our doors. And leadership wasn't real thrilled about that. We have 186 doors to the outside in our facility. That's a lot of doors. It's like, okay, how do you let law enforcement know what door to come to? And that's a communications issue, right? And then if they do come in, They don't know your facility. So another thing we came up with is that we have a bag ready to go that will be brought to the door that the officers are going to come into. That is the interface bag between our safety and security and the law enforcement folks. And inside that bag are card keys that give complete access to the facility, a couple of our handheld radios, because we have an own internal radio system that nobody else has. And so you can communicate directly with the officers that way. And that is just a characteristic of our own system. And maps and diagrams of the facility that are in there. And then an officer, one of our security people, was going to be assigned to that entry team and go with them as safely as they could be allowed to try to guide them to where they need to go. So there were a couple of things that we tried to make that interface with incoming tactical teams and law enforcement more, I guess, a smoother transition and get them quickly to where the incident's happening. And one more thing that we came up with, and again, having senior leadership involved in this really helped, a one-button lockdown. So in other words,
Yes.
they could click
Yeah.
one button and all the external doors can be locked, but obviously that creates problems, right? If your officers coming in can't get in. So that's why they need to be met and brought in, if at all possible. But individual floors, individual units, leadership decided to spend the money and say, okay, if we go into a situation like this and it's in another part of the facility, bam, the lockdown occurs unit by unit, floor by floor, so nobody can get into that area without a badge. Now, that's a problem. Here's another thing to think about. What about code blue teams? Cardiac arrest management teams? What about rapid response teams within the facility? Are they active during an active shooter situation inside the hospital? Are they going to go running through the facility? Doctors and nurses going to resuscitate somebody? Or how's that all going to work? So you got to have a plan or a concept behind that, because you could page them right into the crisis area. So, boy, we could go on all day, guys.
On and on and on. And you mentioned, I like what you mentioned about your command post, or we call incident command, because I remind people, they say, well, what if it happens here? I said, incident command or your command post, it's a process, not a place. It's the process of getting together and having situational awareness. It doesn't have to be one single place within your facility. And we've shown that in a few of our exercises and real events where it has moved and it has become very handy to do that. But great points, Mike. I love it. And you're right. We could go on forever, but great conversation, guys. Anything we want to wrap up with as we kind of finish up, and maybe we circle back around with others on this topic again, but I liked our conversation today. Anything either one of you want to add?
I think Chris ought to wind this up, because this is a primer, right? We're just getting started. This is part one of a very long discussion that could come out.
Hey, I do want to, Mike, while you added it, a couple of things to add on before we leave this issue. One is the idea of the throw bag. That's a good idea probably for all of our departments, whether you have a security, an internal security team or not, is have a throw bag for law enforcement that has the key elements that they need to be able to navigate your facility.
And there's
they
that
still may need some
Italian guy.
assistance.
There's that Italian
Right.
guy bouncing on the desk again. I hear you, Chris.
You can see that. And then the other thing is stop the bleed kits, which are very prominent. And I think we've had some
Absolutely.
discussions about where the appropriate place is for those. One of them might be in a throw bag. The first law enforcement officers in our facilities has been made clear to all of us is they're to neutralize the threat, not to offer assistance. But they are following officers may be able to throw some of those tourniquets. And I know a number of facilities are looking at distributing them. And there's arguments about where to put those in a facility.
Could I make
as well.
one recommendation? That's a great idea, Chris. That's excellent.
Yep, I
What
like
we
that.
did was we put a Stop the Bleed kit in every single public access AED cabinet we had through the complex. Then we purchased very large active shooter Stop the Bleed kits that could care for, I think, up to 8 patients, to include roll-up stretchers and all kinds of stuff. They're almost like a backpack. We bought 3 of those and strategically spaced them around the facility, like one near the main entrance, one down near the ER, one with safety and security so an officer could grab it. So, in other words, those mass casualty kits we purchased, and then again, these things cost money, but you can often get grant money with your local emergency management agency to buy stuff like this. But actually equip and place these things strategically ahead of time is what Chris is talking about, and that's absolutely spot on because they do not expire much, and
Right.
they're really good to have.
The one counter argument I give is that when they're in public places or spaces, and your active shooter threat's underway, you're probably not in there. Or if you are, you may be amongst those that are injured. So you'd have to remember to go out into a public space, get those, and then retreat to wherever you're going to be at. And to Al's point, if you're not going to gathering large numbers, it might make sense. It might to have them more widely distributed within your facility so that those places that people go to hide, they've got those resources readily available if they're in the entryways of their offices or the interior of their offices to be able to access those. So, I mean, I know it's very, very popular to put them where the AEDs are, and it makes sense on one hand, but on the other, if that's not where you're going to be, do you have access to those resources or something to improvise, bleeding control, something to think about.
Well, in units, you got to figure your medical units are going to have supplies too. So I think you really just think about where there's traffic areas and areas that are not patient
Yep.
care oriented. That's where your supplies really need to kind of, at least you devote some of your supplies to those areas because units got supplies.
And it shows not a single answer will fix everything, but it's certainly a lot of options and a lot of things for everyone to think about according to their own facility and what's a best practice for them. So hopefully some of the things today we threw out were helpful, little tidbits, and I appreciate being able to hit on this subject.
And
Well,
let's
we
hope
started
to
a
Al
good primer.
Yep. Let's, again, it was just a informal go round on this one without a lot of preparation, but a lot of reflection on our past experiences. If people have other ideas or suggestions, feel free to share those with us. We're going to park this as we have our other and future podcasts on YouTube. Look for Readiness Rewired, and you can communicate with us also through our email, readiness.rewired@gmail.com, and look for future discussions about active shooter responses involving healthcare, but perhaps not directly threatened by it. In other words, it might be a community response and we're going to be receiving casualties. What are some additional considerations? And we may have a follow-up to this depending on maybe some of the concerns that are raised or additional questions that are brought to our attention. But we hope everybody has a chance to listen and offer their input. And until our next podcast, stay well.